Hi, everyone. Uh, thank you for thank you for joining our webinar. Welcome to this session on lupus and reproductive health. We will wait for another 5 minutes while more participants join the session, and we're also waiting for Dr. Chetana to just join. So until then, please go through the guidelines on the screen. So the meeting will be recorded. And please make sure that your microphones are turned off while the session is going on and the speakers are talking. And also kindly post your questions on the chat box. And the questions will all be answered at the end of the session by the doctor. Thank you. Hello, everyone. Once again, welcome to this session on lupus and reproductive health. The session is part of a month-long series on lupus awareness. Many of you have already joined the other sessions across the month. So, just a bit about what Lupus Trust India is. We are a patient-led advocacy group for lupus patients in India. We are the only advocacy group led by patients, and some of our core mission includes providing, patient support, financial support to disadvantaged patients, and also campaigning for awareness, and also advocating for policy changes that would benefit lupus patients. So that's a bit about us, and the Lupus Karnataka chapter is hosting these sessions. Now, I'd like to extend a very warm welcome to our guest speaker, Dr. Chetana V, who is a senior obstetrician-gynecologist at Aster CMI. She comes with many years with rich experience in the field, and her experience lies in perinatology, high-risk pregnancy, and reproductive medicine. She has also worked as an IVF and fertility specialist in multiple centers. So thank you so much, Doctor, for accepting our invitation today. We are all very eager to learn from you in this session. Thank you, Doctor. Yes. Doctor, you're muted. Could you please? Yes.
Yeah.
Yes.
Thank you so much for inviting me.
Thank you, Doctor.
Thank you, everyone. Yes.
Now, I would also like to warmly welcome our other speaker, Anjali Shivananda, who is a very beloved co-lupus patient and a new mother. So she will be sharing her journey with pregnancy, childbirth, and postpartum care. So Anjali, we are truly, grateful for your willingness to share with other patients, since this is a topic that a lot of patients have questions and anxieties around. So we welcome you, and we thank you for
Thank
being
you
here.
so much for giving me the opportunity. I think Lupus Trust of India is doing a great job. Thank you, Suzanne.
Thank you. Thank you, Anjali. Yes, so we will jump right to the session. The session will be both a kind of panel discussion between, the doctor and also Anjali sharing her experiences. So we will get to the first part of the session, which is the impact of lupus on reproductive health. So to start with, lupus and reproductive health is a very important topic, and something that has come up many times in many of our support groups. So as we all know, lupus affects women and girls 9 out of 10 times around the ages of 14 to 44, which is the time when many of us are figuring out our education, our careers, and also a lot of us are planning to start new families, which is why reproductive health is a very important topic of discussion. When it comes to living a healthy, full life with lupus. So, and it's not just the lupus that affects our reproductive health, but also the medications that we take. So, doctor, my question is, can you please start by talking about how lupus affects the reproductive health of women and girls, including hormonal changes, menstrual cycles, when it comes to planning for pregnancy, etc. So overall, how does it affect our reproductive health?
So lupus, as we know, it's see what we have our immune system. It has a remarkable ability to recognize the foreign pathogens and the own self. So here there is an aberration in lupus where it causes autoantibodies. So it destroys our own self tissues. So in lupus per se, in a mild disease, does not cause much problems with menstruation or with conception. But when it is a severe disease or it goes into systemic lupus erythematosus, the studies have shown that this can have effect on the quality and quantity of the egg. So, and the hormone imbalance can happen because of this, as well as the drugs that are taken. So it's a combination of the disease as well as the disease itself is a chronic inflammatory disease. So there is inflammation in many of the tissues. It affects many tissues, basically the skin, the liver, the renal system, the nervous system. So many and other organs also it can affect. So the same way it can affect the reproductive organs, basically the ovaries, where we are concerned with the ovarian health and reproductive health. So this can have an effect, and the drugs that are taken. Some of the glucocorticoids, yes, that can, which quite commonly is used in flares and little severe disease, and the other drugs that are immunosuppressants, these can also cause damage the ovaries. So it's a combination of both the disease per se, as well as the drugs that are taken can cause problems with reproduction.
Yes, thank you, doctor. That leads us straight to our next question. So you mentioned how some of the medication causes, a lot of side effects. And one major medication, for example, is cyclophosphamide for those of us who are nephritic as well. So a lot of times they ask us if we want to freeze our eggs before starting the infusion. So could you talk a bit more specifically about how these drugs impact our, reproductive organs, and what can we do to sort of, handle that?
Yes, so one is pregnancy in lupus or in severe lupus, systemic lupus erythematosus patients. The pregnancy has to be planned. These drugs, like the drug like cyclophosphamide, which can cause tissue damage. They reduce they are immunosuppressant basically. So this is an autoimmune disease. So these are immunosuppressants which are used in like lupus nephritis, lupus cerebritis, and only in the severe cases these are used. But when that is used, we say at least for 4 to 5 months prior to planning pregnancy, it has to be stopped. So because they are drugs like cyclophosphamide, azathioprine they are not only abortifacient, they cause fetal anomalies also. That means they can cause early pregnancy loss and preterm labors, as well as they affect the fetus. They cross the placenta and they can cause abnormalities in the fetus. So when the patient is on cyclophosphamide, better to avoid pregnancy. Cyclophosphamide, azathioprine, any of these immunosuppressants.
Right.
Here, the safest would be the glucocorticoids, but yes, they also can cause certain other complications in pregnancy and prior to pregnancy.
Right. Thank you for that answer, doctor. And, you mentioned how pregnancy should be, as much as possible avoided when these medications are going on. But a lot of times a common complication is unplanned pregnancy. So there's always been a lot of doubts about how to handle this safely. And, with lupus patients, it can lead to very serious side effects. So how can lupus patients handle unplanned pregnancy in a safe way?
So we have to take the history, like how long the patient has been in remission. That means she's not had a flare or any kind of disease as such, and she's been free of the disease. For how long? And has she been taking the maintenance drugs that have been given? The safest is hydrochloroquines, that is HCQs. They are the safest. They can be taken in pregnancy also. So if the patient has been on these drugs for prior to pregnancy and she's in remission and it is an unplanned pregnancy, then it is we do certain tests, that is the blood test, workup. All the workup is done, the renal profile, the complete blood count, the liver profile. So these and see for her baby how it is, the pregnancy ultrasounds. We do that and we monitor if everything is going well. We monitor and continue with the HCQs. And this is actually a multidisciplinary problem. So we involve the rheumatologists who actually take this, do all the investigations that is needed, and we treat the pregnancy part of it, and both together we have to manage the patient.
Right, right. Doctor, and in the case when the patient doesn't want to go ahead with the pregnancy, what are some of the kind of, ways to handle it? What is safe for patients? There are a lot of over-the-counter medications which might not be always safe. So could you please talk about how to deal?
Yes. We can do a medical termination when the patient does not want to continue the pregnancy, and it is not possible for her to continue. Even then, we can do a medical termination, which is quite safe, but we would always recommend or advise the patient to go to a doctor to get the proper medication for a termination, and which is given at the right time. So if she's crossed beyond the medical termination gestational age, then we'll have to think of safe way of delivering the baby. And we call it delivery because it is done that way. We cannot do a DNC or DNE, what we call it. So we deliver it in the second trimester or early second trimester to, like, it's like an abortion, but second trimester abortion. But it has to be done in a safe way. We give tablets as well as induce the pain for that, for aborting the baby.
Right. Thank you so much, doctor. That's very, valuable information for patients. So in terms of preventive measures, what are some of the best practices and options for birth control for lupus patients?
So we have different contraceptive methods so that she does not have an unwanted pregnancy or a pregnancy which is not advised in a particular time of her relapse, or she's in a severe case like a nephritis or cerebritis. So that time we can, the one of the method is an intrauterine contraceptive device, quite safe. Only thing is it is not 100% efficient. It has its own failure rate. The others are pills without estrogen. So we give a progesterone only pill because estrogens have a tendency to increase or the disease per se, lupus per se, and also they increase the tendency for increase hypercoagulability. What we say, that means the lupus patient has a tendency to form clots, and that can cause embolism. So that is why we have to avoid any estrogen related pills. So we can give a progesterone only pill for contraception. We also have injections which are progesterone only, which can be given timely, that once in 3 months, like that. And we also have an intrauterine device which is progesterone coated. So these are the methods which can be used to prevent pregnancy, and they are temporary. They can be reversed once they stop that, when they
Okay.
decide to have a baby.
Right, right. Thank you, doctor. With that, we will move to the second part of our session, which is gynecological health and safe sexual practices for lupus patients. Gynecological issues are a very common complication for lupus patients. You mentioned, because of our immune suppression medications, it makes us very susceptible to infections like UTI and sexually transmitted diseases, and other issues like vaginal dryness, etc., which can really get in the way of not just a healthy life, but also, a healthy sexual life for many patients. So, doctor, could you please talk about some of these common gynecological issues and infections that can affect female lupus patients, and how can we deal with them? How can we handle them?
So yes, if the patient is on immunosuppressive agents, they can be very prone to infections. Like very commonly, the urinary tract infections. One of the commonest. They can have asymptomatic bacteriuria too. So regular checkup is very needed when they are on immunosuppression. One is they have to take care. Personal hygiene is very important, and drinking a lot of water and keeping themselves very aware of what their body is telling them. That is very important. And as you say, the sexually transmitted diseases, yes. So the sexual health is very important. That is safe sex methods, having a single partner and seeing that the partner, if they have any kind of issue that he has to be or she has to be treated so that there is no cross infection. And once they have any kind of discharge or chronic discharge for a long time, having white discharge, they have to come to the doctor so we can take the swab. Firstly, we examine, see the cervix, see what kind of discharge. We take the swab, see what bacteria or whatever pathogen is affecting. So we have to treat them. Timely treatment is very important.
Right, right. And doctor, a lot of lupus patients suffer with chronic fatigue, which really impacts several areas of life, including, their sexual libido and their sexual life with their partners. And this can often also come in the way of, relationships, marriages. So how would you, advise patients and their partners on how to deal with this?
Yeah, fatigue is one of the commonest symptom of lupus patients, especially systemic lupus erythematosus patients. So we have to do all the workup first. That is regularly done, of course, but certain things which can add to their fatigue, like anemia, vitamin D deficiency, vitamin B12 deficiency, or any underlying infection, which is not actually very obvious, but because they are on an immunosuppressive therapy, they can have underlying any kind of inflammation, can cause fatigue. So this treatment is very important on a regular basis to do the blood workup so that if there is any deficiency, we have to treat. There's one more thing is her anemia. The cause for anemia is her menstrual cycle. We'll have to see, is she losing a lot of blood? Is there any anemia because of blood loss? So that has to be treated. So we have to treat the anemia as well as reduce blood loss. So this has to be dealt with. The other part, of course, vitamin D supplements and a healthy lifestyle, eating a lot of healthy food stuff like vegetable, high protein diet, and healthy lifestyle, that is avoiding smoking and alcohol as much as possible. So these also add on to their whatever you say, the libido or her desire to be with the partner and sexual life.
Right, right. Thank you so much, doctor. Also, you mentioned briefly about how, these general healthy lifestyle would really contribute to a healthy life. So, doctor, could you also just elaborate a bit more on the preventive care that lupus patients should take when it comes to their reproductive health? So this could include, safe sexual practices, and also importantly, can you talk about, the vaccines that are needed to be taken regularly for patients, and also the kind of diet, lifestyle, if you want to add anything else? Yeah.
Yes, of course. Healthy lifestyle goes a long way for all the patients. So this includes a healthy diet, which has a high protein diet with all it's a balanced diet should be there. We can take the dietitian's help, or if they know what what is good and what they are not able to tolerate, or if they're putting on weight. So whatever it is, the healthy diet plays a long way, and a bit of exercise, whatever, like 5 days a week, half an hour, 15 minutes, whatever they can. That much of activity is very important, because yes, they have fatigue, they have arthritis, they have muscle pain, everything goes with that. But when they are able to do whatever is needed, even they can take the help of the physiotherapist or whoever will teach the exercise that they are able to, the joints. So constantly doing the whatever, when they're sitting, working, they can be moving their legs or their hands, their fingers, their joints, the wrist joint, the ankle joint. So keeping them a little bit active is very important. And of course, the vaccine part of it, yes, regularly the tetanus toxoid can be taken on a regular basis every 5 years, which we give. And the other one is influenza vaccine. So avoid flu. that can flare up when they have an SLE or when they are on an immunosuppressant. The one from our side, what we are now promoting is human papillomavirus vaccine against cervical cancer.
Right. And how often would you suggest that patients should visit their gynecologist, for a regular routine checkup, doctor?
Once in 6 months, if they have no problem, menstrual cycles are fine, then once in 6 months would be ideal. But if they are trying for pregnancy or they have any issues, any heavy bleeding or any kind of issues, then more often, so that we try and treat that.
Right. Thank you, doctor. With that, we move to the next part of our session, which is lupus and planned pregnancy, how to go about, a full term pregnancy, childbirth, etc. So, considering all the risks and impact of lupus that we just discussed, taking the decision to, start a new family with children is definitely something that needs to be very well thought out for lupus patients. So, doctor, what are the prerequisites needed for a lupus patient to start planning for pregnancy? When would you say is the right time to start planning for this? And how should they prepare in terms of medication, physical fitness, blood work, etc.? How do they go about planning for it?
So, one, of course, is that they have to be in remission, and for a sustained remission for a few months before they plan. And if they are on immunosuppressants, like I said earlier, about 4 to 5 months, you'll have to stop the medication. One of the safest is HCQs that can be continued on a maintenance dose, whatever the rheumatologist or their lupus doctor has told them, that has to be continued. And that is very important. If they have not taken the maintenance dose or maintenance drug for some time or for any reason, then the problems can happen in pregnancy, that either in the baby or maternal or fetal problems can happen. So maintenance dose to continue, that is very important, and they should be on remission. And of course, the workup, all the blood tests we do, the complete blood count, the renal, very important here is the renal profile. So how is their kidney functions, and certain other parameters like the scan, of course, ultrasound of the pelvis we do as a preliminary thing just before conception. So if they are having any other issues, that is hindering conception, so we'll have to treat that too, of course. And then once they have we have done all that and they are ready for it, definitely they can go for to plan for pregnancy.
Right. Thank you, doctor. Anjali, I would like to invite you to answer the next question. Maybe you can just, yes.
Hi.
Yes. So, Anjali, once again, thank you for sharing. Pregnancy and childbirth is a very personal and complex journey. So, it's amazing that you've stepped forward to talk about this. So, I would like to ask you, when you started preparing for your pregnancy, what were some of the things that, that you didn't expect, and how did you feel through this journey? What was that experience like? And also, just for the audiences, Dr. Chetana is also Anjali's doctor, so yeah, just for context. So please, Anjali, over to you.
Yeah. Thanks, Suzanne, for the question. I think even like before pregnancy, one thing that we all need to make sure is our partner is on the same page as us. In that, like being very open with if he's going to be a potential partner, and if you've been diagnosed with lupus before marriage, to tell them that see, this is what I have, this is the condition what I have, and telling that pregnancy might be a challenge, and so that we are all on the same board. And unplanned pregnancy is something that we cannot take a risk with. So I think that was the first thing that I did, like before marriage, is having a partner who understood what my condition was. And now, fast forward to like after 7 years of marriage, we plan to start a family in 2022. And I think a lot of what Dr. Chetana said, I have examples for that. In 2022, while I was planning to start, I got COVID even after taking third dose of vaccine. And as you know, like platelet count is an issue with lupus. So once I got COVID, although the external symptoms were not there, but my platelet count decreased to almost 3,000. And that time, like obviously you can't plan on having a family. So my rheumatologist tried his level best with medicines to increase the platelet count. But then in 2023 June, I was given like 2 doses of rituximab injection. And I think just like the last question that you asked, Dr. Chetna, in terms of planning pregnancy, after taking certain medicines, you need to wait a certain time before you start, going ahead with pregnancy. So after taking the rituximab injection, I had to wait for 6 months. Then after 6 months, I was also on one of the immunosuppressant tablets called MMF. You're not supposed to conceive when you're taking MMF. So my doctors gave the rituximab injection. Then he slowly tapered down my MMF tablet, and then I had to wait for 2 to 3 period cycles after stopping MMF completely, and then he gave a go ahead. So in 2023 July, I got the rituximab injection. Then in 2023 December is when we started on planning the pregnancy. And even before that, I got my Dr. Chetna gave certain tests for me to get done. And even for my husband as well, because even there are certain tests for the partner. Then once everything was fine, the scan was fine, then we planned. And in 2024 January, we conceived. In terms of what I didn't expect in my pregnancy, I would say overall, if I look at it from a larger perspective, it was quite smooth, except that in the first trimester, I had something called a subchorionic hemorrhage, so I had a little bit of bleeding. So the first trimester, I was asked to be on bed rest. And again, like Dr. Chetna had suggested, to go on a healthy diet, no maida and no outside food. So I just followed her instructions very strictly. And I also had like my family over here. So when you're on bed rest, you also need like an environment to help you, right? Yes. And then then things were fine. My hemorrhage disappeared completely. Then in the second trimester, I started going for prenatal workouts. I even traveled again after getting a green signal from my doctor. Then afterwards in my 8th month, it was not related to SLE, but I was diagnosed with dengue. And I think one of the best decisions I had taken earlier in my pregnancy was to consult in a multi-specialty hospital where like we have doctors, internal medicine doctor, gynecologist, and rheumatologist. So when I was diagnosed with dengue, I consulted at Aster CMI, and there was excellent coordination between all the 3 doctors. For 7 weeks I was there. I mean, for 7 days I was there. And I could, because of the good treatment that I got, I could complete my full term of pregnancy, and I was able to deliver. So that was unexpected, but I think that was both my husband and I asked, will SLE be a problem? Like, will it be considered as a complicated pregnancy? That time, like Dr. Chetna assured us, no, not really. So dengue was not related to SLE, but then we did plow through it.
Right. Thank you so much for sharing that, Anjali. We will also, come back to more questions on your experience. So you did mention, some of the complications that could arise in between in your case as well. So my next question to Dr. Chetana would be, what are some of the risks that can arise during pregnancy, specifically for lupus patients? And we also hear of a lot of very, heartbreaking stories of how patients have lost their pregnancy through spontaneous abortions, and gone through a lot of pain and anguish. So doctor, could you talk about some of these risks and how do we identify them, treat them early on, or even prevent them?
Yeah. So one thing that always the studies also say is that prior to preconception, how many a few months of sustained remission is very important, and also not to be on these drugs which Anjali mentioned. So these for some time, at least 4 to 5 months, to stop, because that can cause, like I said, the cyclophosphamide is an abortifacient medicine that can cause abortion or a loss of early pregnancy loss, the miscarriages, what we say. So that is important. So early pregnancy, so whatever she had, that subcorneal hemorrhage, not really related to SLE as such, but yes, that is also one of the things which we have to recognize. They'll need more monitoring and recognize things and treat them. Timely treatment is important. Then going on, like flares, one of the complications of flares in pregnancy, because pregnancy is a stressful period physiologically, so it can cause flares as well. But that again, it has to be recognized and treated along with the rheumatologist, of course, and they do give, but they say that HCQs, if they have been taking on it, I mean, whatever the doctor has advised in a proper way, flares can be prevented. But if they are, there's definitely glucocorticoids are given. And some of the complications because of flare and glucocorticoids are also there, because glucocorticoids definitely cross the placenta, so they can cause certain problems. And also the NSAIDs, which can be given in pregnancy but avoided. So more safe is the paracetamol, but other drugs like anti-inflammatory drugs, which cross the placenta, can cause certain problems like renal insufficiency, as well as oligamenous, that is amniotic fluid being less in the baby. So, and IUGR, preeclampsia, that is hypertension and pregnancy with the renal disease. So everything has to be regularly monitored so that we have the idea is to give a treatment that is both effective enough and safe for maternal and fetal health.
Right. Thank you, doctor. There is also, although a very small chance, there is also the chance of neonatal lupus for the unborn child. So, doctor, could you talk a bit about, the occurrence of neonatal lupus, and, how does it affect the child if it happens? And, how do you handle this case?
So neonatal lupus is very rare. They say is about 5% in severe lupus patients, and this is more because of the transplacental transfer of the auto antibodies to the baby. So this, they say, is more in certain antibodies, that is more in case of Sjogren's syndrome, the other autoimmune disease, and not lupus per se. The study is still going on, and this causes babies to have some rashes, and which are recognized, and they say it is mild, it will be there for 2 to 3 months and it will go away. But certain times they can go into a severe form of neonatal lupus too, which the worst is the complete heart block. That is actually recognized in pregnancy, also between 16 and 24 weeks, where there is a bradycardia, that is a low heart rate of the baby, which goes on. It's a sustained bradycardia where that is recognized, that is not very compatible with liptasing. But then once after delivery, if that is recognized, then of course there are other things like pacemaker can be given and the baby can have a normal life.
Right, right. Thank you for answering that question, doctor. Um, yes, I would like to ask the next question to Anjali. So Anjali, you talked a bit about how, you really worked hard to take care of yourself during the course of your pregnancy. I would like to ask you, very specifically, what are the kind of things that you did in terms of, lupus management, your diet, your lifestyle, just over the course of 9 months, what was your life like?
Okay. Yeah, I think it's not just the 9 months, right? Like the discussion, like if I summarize what Dr. Chetana has said, is that even before there's so much of precaution we need to take. So, like, I had stopped alcohol and like 1 year before, and obviously that's very socially I was drinking, but no alcohol. And I was making sure I didn't have the option of work from home, and I had to go to office almost every day. And one of the hardest decisions that I had to take while also planning for pregnancy was to leave my job because it was getting very stressful. And I had mentioned earlier that like 20, I had started like from 2020. We wanted to start from 2022. And you have also mentioned that how we are prone to infections. And I was working with the government of Karnataka and had to go to office every day, and the washrooms were not neat, and it was a tough call I had to take. So I left my job. And then I conceived. And during pregnancy, I think the first most important point is to to identify a good gynecologist, and like also have a good rheumatologist to make sure that you are in sync and you have the same wavelength. And I just listen to my doctors. That's the most important thing. Like, never miss out on our medications. And if they say that you have to take bed rest, make sure that your parents, your partner are there to support you. That bed rest means actual bed rest and just going to the washroom and coming back and lying down. And I liked reading books, so I didn't, although because of my work, I didn't have the time, but I got back to that habit. Like mental health is also very important. Because initially, like after the hemorrhage, I was just so scared, like, oh my God, like, will that incident happen again? So I had to make sure my mental health was also good. So I used to read a lot of books that like lot of fiction, and then I used to watch a lot of OTT content, which just got my mind like a little happier. And then eating healthy is avoid outside food. I just they never like restricted on certain things, like there are certain notions that pregnant women are not supposed to eat papaya, not supposed to eat certain things. But I just listened to my doctor and said that no outside food, no outside food, no maida, no maida, just eat healthy. That's it. And once I got the go ahead, I identified a specific prenatal class, like exercises for pregnant women. So I was exercising almost till the day before my delivery also. Just like again, once I got a green signal from my doctor. That is the main thing. First thing is like always listen to your doctor, irrespective of what your family members might be saying. They were my only source of information. That is how I prepared. And yeah, this is it. Exercise. Well, number one is first identify good doctors that you share same wavelength. Second is listen to them till three dots and dash. And third, keep your mental health at bay.
Thank you so much, Anjali. That was a wonderful, insightful sharing. And mental health is definitely, I think, something we should all keep in mind, especially going through such intense situations. So yes, thank you, Anjali. The next question I would like to ask to Dr. Chetana. So, once the child is born, and there's a lot of stress, and also sleepless nights for a mother. So how what kind of postpartum care do lupus patients especially need, and in terms of also keeping the lupus activity in check, the special medical care, etc., support that they would need from their doctor?
Yeah, so the postpartum period is as sensitive and as stressful as the pregnancy in anybody. So in lupus, it becomes even more. And like Anjali said, she has to leave a job, but once the baby comes out, it's a 24/7 job. So that sometimes stresses people. Sometimes it's a happy thing. They'd like to take care, but definitely it is stressful for the first time mothers, especially. And in lupus, they have this. One thing is that medication should never be stopped, whatever it is, and it has to be continued. So HCQs, if they are on maintenance dose, it has to be continued. Any flare, anything has to be immediately treated. Breastfeeding as such, they can definitely continue with HCQs. That is not need not be avoided. Again, I stress on the fact that they have to eat healthy, sleep well. See, it is difficult. That is important that they get some good sleep. Like it is a sensitive, very difficult period for the first time mothers, and especially now that she is a lupus patient, that is also there. So getting enough sleep, that is, we always say when the baby sleeps, you sleep. It may not be so easy, but that is what has to be followed for her to get some rest, but otherwise there is no rest. So eating healthy and some of the tests which have to be continued to be monitored, like blood tests, renal parameters which are important, uh, has to be done. Any flare has to be treated. The main thing they give is the glucocorticoids, that has to be taken. And then otherwise, like he said, mentally it is stressful to keep themselves distracted, even postpartum too. What we call postpartum depression and all that, it can flare up that way and go to another extent. So that very important that she needs help, like some kind of support system for physical as well as mental, to taking care of the baby. Sometimes they go into such depression, they don't want to care for the baby. So that to avoid that, of course, if that is there, the treatment also becomes different. There is treatment, definitely. There's no need to worry about it, and there's no need to panic that there is something I'm not able to take care of the baby. But here, again, support, and we counsel the caregivers to the husband and the parents, whoever is around her. The support system is very, very important. And Anjali is a brave lady, I'm sure. She definitely went through it very well, and she has a lovely child now.
Thank you, doctor. Yes, I was just going into my question for Anjali when it comes to postpartum life. Just a minute. Yeah. Right. So Anjali, I think it's been a couple of months since your little one has arrived. So I'd like to ask you, what has the postpartum experience be like? We know that just breastfeeding itself is also a very, difficult process for new mothers. So, what has it been like so far, and what kind of encouragement would you give to other lupus patients who have also maybe just given birth, or are about to, or are planning to? Yeah.
Yeah. I think now that I've experienced postpartum, I would say pregnancy was like so much more smoother than postpartum. But then I've also heard like people have had more difficult postpartum journeys. I think for me, I had like the support of my family. To give very specific examples, my mother took care of the kitchen and the cooking, and my husband had like 2 weeks paternity leave. And then we also had a 24 hours nanny for 78 days of postpartum. Because I don't want to scare anyone, but at least for the first 2 to 3 weeks after delivery, we need to feed the baby every 2 hours or every 3 hours. So you in 24 hours you need to like do 12 feeds, and then you need to. One of the most challenging was not the feeding but the burping part. And I think it's very important that you have some help, because when I used to feed the baby, like I'm still breastfeeding. When we feed the baby, I would give the burping part to my husband or to the nanny, because then I would get that, sleep for the next 2 hours. It's very important. And that sleep is also important for the supply of our breast milk as well. It can be very arduous. And I've heard a lot of stories like from my friends that where they have gone on very restrictive diets, like no dal, no this, no that. Like they're just made to eat very bland food and everything. So that I think is a myth, because if we have to be healthy and if our body needs to be producing like breast milk, the baby is on breast milk for the first 6 months. So my baby, when he was born, he was 2.79 and he decreased to 2.40. And after like 6 months, he was like 7 kgs only on breast milk. So that's how nutritious it is. And so it's very important that we get the support of the family. And as gut wrenching it was to me to leave my job, I don't think so. Even after 6 months of my maternity leave, I could have gone back, because somewhere it gets very tiring. And one thing I made sure that, like when I was feeding every 2 hours for the first 2 to 3 weeks, was I slept in those 2 hours. I didn't watch my phone, because it's very important. And also in the afternoon, like when I was sleeping, my husband would take the baby to the next room, so that I could get some uninterrupted sleep and all those. So that the kind of support is definitely needed. And in terms of like medications, I made sure that it you can tend to forget, because the only thing in your mind right now is your baby, and sometimes you can tend to forget. So what I made sure was I put a reminder on my phone, like that task, like a task, so that it's marked completed. So I never forgot my medications. That was really important. And diet is extremely important. By diet is like not starving ourselves, just cutting out on outside food, but eating healthy homemade food without any restrictions on that, without any cutting out on some vegetables, dal, and all those things. I also have another point that I need to tell. Was while I got dengue, I was in Aster and there was excellent care that was taken. But also after delivery, I think we should also find a good hospital which has a good pediatric unit, like some like neonatal pediatricians who have good experience. Because after delivery, I felt a lot more confident that my baby was in good hands, because the pediatric unit, I'm not promoting a hospital, but the pediatric unit at Aster CMI was very good. There are certain tests they saw I had done of lupus to see if it was positive. Because if certain indicators in the blood test is positive, then there's a possibility of the child having neonatal lupus. But again, like what Dr. Chetana said, it's the probability is very, very less. But still, they don't take it lightly. And also, I had dengue, so the aftercare that my baby boy got after delivery, like they made sure everything was fine. And also, I started breastfeeding, but he lost a lot more weight than he was supposed to. So they made sure that they took very good care of him. Like I had to stay there for 2 extra days, but the support was really good. And I think for postpartum, it's very, very important that we don't follow certain myths. I've had friends who they say that they're not supposed to come out of the room, their curtains are closed, they're not supposed to see the sunlight. They're just very random things. And I think that actually causes like postpartum depression. And we should we should make sure that like sometimes the focus will tend to shift towards the baby because he's like the sunshine in our life, but then the mother also needs that kind of support. And I think the family is very important, like to give such support, friends and everyone. So I got that kind of support, and that's why my postpartum journey was like touchwood was really great, and it's still going great.
Wonderful, wonderful. Thank you so much, Anjali, for sharing. And, also we really love to hear that, how supportive families and partners can be. And I think that's an inspiration to many other patients as well. So with that, we come to the end of the main session and we will move into the question and answer round. Doctor and Anjali, I hope, would you be able to spare another 10-15 minutes for this question and answer round?
Sure.
Yeah. Yeah.
Yes, thank you so much. So we will just go into the chat box. Yeah. So Abida has a question. If pregnancy is not happening naturally, can we go with IUI treatment instead of IVF? And will it provide a positive result?
Well, whatever is indicated, we'll have to check whether IUI is feasible, whether it is going to result in pregnancy. Definitely, you can go for it. See, these two are totally different. IVF is different, and IUI is different. IUI is just something which is better than natural, is what we say. The chances of pregnancy in natural, if it is about 78%, in IUI we say is about 15 to 20%. So that is what it is. IVF is a totally different thing. The fertilization itself is outside and we put in the embryo. That is totally, those two are totally different. And the indications will be different.
Right. Thank you, doctor. Her other question is, what medicines need to be stopped? Okay, she's given a list of medicines. I think that question might be better answered by your treating doctor because these are very specific medications for your specific case. So maybe we will skip that. But thank you for your question, Abida. The next question would be from Ishwarya. Before getting pregnant, any preliminary tests or genetic tests available to check if the kid might inherit lupus or not?
They do certain antibody tests, which they say if the patient has those two, the baby can have neonatal lupus, which is not regularly done. It's not even time tested. So some centers do it, but they say the weighing the cost effectiveness and doing those tests may not be really correlating.
Right. Thank you, doctor. The other question before, okay. Yeah, I think it's repeated. Toishi has a question. Ma'am, can we get pregnant while having AVN or surgery? I didn't get that. THR surgery. I think AVN surgery is what she means.
I didn't get it.
I think she means, ma'am, can we get pregnant when there's an avascular necrosis flare going on?
During flares, we definitely wouldn't advise. It's always better to postpone. Like I said, there should be a continuous remission for some time, some months at least, without flares.
Right. Thank you, doctor. Is it necessary to take cervical cancer vaccine after delivery or any other vaccine that SLE patients need to take after delivery?
It is not like a necessity we are promoting. It's a cervical cancer vaccine which is promoted, and when they are postpartum, that is still in the hospital or will be coming to the hospital for a check, it's easier for them to take. That is the only reason that is promoted. It can be taken anytime.
Right. So Tabu has a question. I have PCOS. My periods are irregular and my weight is gaining so fast. How do I manage it?
This is a PCO treatment. That weight gain is a part of PCO, and PCO increases weight and weight worsens PCO. It's a vicious cycle. So she has to fight that. And first line of treatment is weight reduction. I don't know if she's trying for pregnancy, but yeah, the management part of it in PCO is a totally different entity.
Right. Next question is, what is the possibility of the child contracting lupus from the mother with SLE? I think we've discussed this. It's a
Yeah.
small chance. Would you like to add anything, doctor?
Like I said, they do certain antibody tests, the two antibodies, but they say more in case of Sjogren's, the lupus antibody is transmitted than any other. It is a very low risk, and if it is mild, it's just about 2 to 3 months of rashes, and then the baby will be fine. The complete heart block, what we spoke about, is quite rare.
Right. Dharmishta is asking, is SLE, can it be herited from the father?
It is genetic, it is not hereditary.
Okay.
Genetic predisposition is there for SLE and environmental factors, and it is not hereditary.
Okay. Madhu is asking, where is Dr. Chetana treating? She works out of Aster CMI, so you can reach her there. Suman has a question. Patient has lupus, any chance of the baby also having lupus? So doctor just answered this question, so I hope that was satisfactory. Toishi has a question to Anjali. Um, did you have a normal delivery or was it cesarean?
So I had a cesarean section because it was more of like a planned one. There was a cord around the baby's neck, and Dr. Chetna did give me options of going for a natural delivery through inducing, but I just wanted to be in a more controlled environment, and I went for C-section.
Right. Thank you, Anjali. Yeah. Is skin lupus pregnancy possible? I think what you might mean is when there is a skin flare, is pregnancy possible?
It's not about possibility, maybe possible, but better to avoid during the flare.
Right. And how to deal with fatigue? Any superfoods to include in diet, or can we start iron and calcium again? I am 11 months postpartum.
Iron, calcium, we just keep for about 2 to 3 months. That is when they're feeding, and that's more than enough. But fatigue has many reasons. Like I said, it is a stressful period postpartum, maybe not having enough sleep, may not be having enough food. They'll always be thinking of babies, not enough, not taking care of themselves. That's when it happens. So that is important that eat healthy, eat well, and take care of yourself too, including the baby.
Right, right. Toishi has just clarified a question. She meant to ask, after total hip replacement surgery, is it safe to plan for pregnancy?
Hip replacement? It is. We can have pregnancy.
Okay, okay. And yeah, the last two questions. How difficult is it for lupus nephritis patient to conceive compared to other, lupus patients who don't have nephritis?
Nephritis patient, that shows that it is a systemic lupus and they are on immunosuppressant drugs, and it can cause problems getting pregnant, definitely, and complications in pregnancy. The risk of complications in pregnancy are also more.
Right. Thank you, doctor. The last question from Madhu. I have lupus nephritis class 3. I have irregular periods. I have anticoagulant mild positive. Is it possible for her to conceive?
So she has to meet her lupus doctor and see the same thing. We have to see what she's taking, stop it for some time and see how the remission is, and then continue the maintenance dose of HCQs, and then try for pregnancy, definitely.
Right. With that, we come to the end of our Q&A session as well. Okay, there is one last question, Doctor, if we can take that, and then we will stop with that. Can you share again about safe sex ways for couples not looking to get pregnant since the wife has lupus?
Yes, like IUCD is one, that is intrauterine contraceptive device, COPD, or a progesterone-coated one. Definitely can be used for 3 to 5 years. And then we have the progesterone-only pill. And we also have the progesterone injections.
Right. All right. Thank you so much, Doctor. With that, we come to the end of our session. I would like to call upon Priyamvada, who is also, our patient leader in the Karnataka chapter, to give the vote of thanks. Yes, over to you, Pri.
Thank you.
Sorry. Sorry, we can't see you and your audio is a little choppy.
Just give me a minute.
Sure, sure.
Now?
Yes, we can see you now.
Is it better now?
I think the network.
And the audio, is it better now?
Yes, we can
Just
hear
give me
you.
it.
Yeah.
Just give me a minute. I'll just connect it to a better network.
Sure, yeah. We still cannot hear from you. Yes.
Is it better now, Susie?
Yes. We can hear you. Maybe we can just carry on. Yeah.
Yes, all right. So, as we come to the end of today's insightful and thought-provoking session, the webinar on lupus and OBGYN, I have the honor and privilege of delivering the vote of thanks on behalf of Lupus Trust India. First and foremost, our sincere thanks goes to our distinguished speaker, Dr. Chetana, who brought in exceptional clarity and depth to a complex, sensitive, and also a crucial topic. It was one of our most commonly discussed topics amidst patients and patient support group. Your expertise and insights have helped illuminate the important intersections between lupus and women's reproductive health, an area that deserves much more attention, I feel. A heartfelt thanks to our moderator, Suzanne, who has also skillfully guided the discussion and ensured every voice was heard, every questions were answered, and important topics were touched upon. To our patient speaker, dearest Anjali, we're very deeply grateful. It takes a lot of courage to come out here and speak about your intimate journey publicly. And it is so personal and yet so special that you could come in and bring in important insights about the same. This session also marks the concluding of the webinar series that we have been having this month every Sunday as a part of our Lupus Month awareness campaign. Thank you on that note. Thank you to all the attendees who have been there through all the 4 webinars, and the panelists, the partners, the speakers, the moderators. Your participation has only amplified the awareness and reduced the stigma and helped us move closer to a more informed and compassionate understanding about lupus. A special note of appreciation to the entire team of Lupus Trust India, who has made this happen very smoothly, starting from our technical support to our designers who brought out posters, and to the post-production teams also who are helping us out with posting these recorded sessions on our YouTube channel, which will be available for further and future reference also. So do look forward to those sessions. Share in those words, share the links as we put out the recorded sessions. So this brings us to an end of the Lupus Month 2025. And what a wonderful way to end the campaign with having such a sensitive, crucial, and compassionate topic as our webinar series. Thank you, everyone, and hope to see you all again in future initiatives that we will be bringing about. Thank you all. Thank you, Doctor. Thank you, Anjali.
Thank you. Thank you. Bye.
Thank you so much. Bye-bye.
Thank you, Sujan. Thank you so much. Thank you, everyone. Special thanks to Anjali, who brought me to this forum, and it was wonderful connecting with everyone.
Welcome, Doctor. Thank you.
Thank you all. Thank you, Anjali and Pri. Yeah. See you all. Bye. Bye.
Bye.